The rainy season began in May in the camp. It's now July and there are downpours nearly every day. For families who fled the war in Sudan, this means that living conditions in the camp are going to worsen. The rains are likely to last until November. In 2012, during the same period, poor sanitation conditions led to the spread of infectious diseases. The mortality rate among young children was significantly above the emergency threshold.
The lessons learned from last year were that malaria, diarrheas and acute respiratory infections were the main killers. So in order to prevent those diseases to spread in the camp this year, we launched a water and sanitation program, and at the moment we're doing a vaccination campaign to prevent mainly, but not only, respiratory tract infections.
MSF chose the pneumococcal conjugate vaccine for this campaign. This is the first time it's been used under such precarious conditions. 3 series of injections administered over a 3-month period should cover 5,000 children less than 5 years of age. The problem is organising the campaign in the midst of the rainy season. Supplies were delayed by lengthy negotiations with laboratories to obtain the vaccine at an affordable price. This delay prompted MSF to issue a warning. Access to new vaccines for children in crisis situations must be improved. Sebastian lives in Benzambe, north of the capital of Bangui. Like many people, he fled the violence that has affected his country for several months. When he came home, he took stock of the damage.
During the recent fighting, the rebels came to our village and we fled into the bush. When we were hiding in the forest, the hospital was looted and all drugs stolen. Now we have no place to go when we are sick.
Today, an MSF team is in the village. Sebastian thinks he has malaria, so he's come to be tested.
The test is positive. You do have malaria.
Due to this violence that has also hit this village, the little that they had, the little staff that there were, have also fled. So now there's no healthcare at all. And that's the reason that we've picked this location to come and do a mobile clinic here today.
Malaria is not the only threat facing this population. The nutritional situation is worsening and antiretroviral drugs are no longer available. These problems, among many others, have led MSF and 4 other NGOs to condemn the abandonment by the United Nations and donors of the country's humanitarian and health needs. That withdrawal can only worsen an already alarming crisis. At the Sana detention center, Awel, an Ethiopian, tells his story.
Witnessed and experienced it.
Unemployed at home, he decided to take his chances in Saudi Arabia. His route took him across Somaliland and Djibouti to Yemen. He was taken prisoner there and tortured by traffickers before managing to escape.
They took me in front of the others who were staying there, and they started the torture. They told me I have to call and get their money now. They hung me with my fingers on the roof of the hut where we were staying. So it was very painful, really.
Most of these men have had the same horrific experience: extortion, torture, and sometimes rape. Those who were freed in April by the authorities have already returned home. This has encouraged many other migrants left on their own to leave the country. They have come to the Sana detention center, which has quickly become overcrowded. MSF launched a mental health care program there.
they are very worried about the future. They don't know what is going to happen with them. They don't know where they are going to be deported. They feel anxious because of the uncertain future. The most of them, they don't have money because they spent all of their money they spent on during the trip. So they are very anxious because they don't know what to do when they come back to their places.
Since April, 4,000 migrants have already returned to their country of origin. However, authorities estimate that 30,000 Ethiopians are taking their chances along the Saudi Arabian border, still at the mercy of the traffickers. Gaza, late June. Some 30 doctors have gathered at the Al-Shifa hospital. Since it is difficult for them to leave the Gaza Strip, MSF decided to organise trainings on site.
The discipline of intensive care medicine is rapidly evolving all around the world. This is why this course is conducted all over the world. I believe that this course is going to change the practice of intensive care a lot in Gaza.
This 3-day session is devoted to intensive care. The objective is to learn to intervene as effectively as possible within the first 24 hours after a seriously ill patient is admitted.
I hope that this course is going to be run regularly in Gaza. It's going to improve the outcome of the patients and the care of the patients in the critical care field.
The physicians will receive a certificate from the University of Hong Kong upon completing the training, which is recognised by major health institutions. There are also long-term training needs. At Nasser Hospital in Khan Yunis, an MSF nurse who specialises in intensive care works alongside the staff every day. This bedside training programme has been designed to meet the needs of the Gaza population. Screening and treating HIV-positive people requires several tests. They are complicated and must usually be performed in a laboratory in a major city, which slows and complicates patient treatment. To address that problem, the MSF team in Chirad Zulu provides the health centres with tests that are suited to conditions in the field. A new machine, Samba, has just arrived. It will be installed in 2 centres and will be used to measure the quantity of the virus in the blood of an HIV-positive person.
It's very important to us to have the Samba machine at the health centre because it will allow us to verify the effectiveness of the HIV patient's treatment and, if necessary, confirm treatment failure. We can then begin the process of determining why the patient is experiencing treatment failure and continue that process. Up to now, only large regional or national laboratories could conduct these kinds of tests, and the results were often lost. In any event, those large labs have limited capacity. They can't test viral loads from the entire country, so it was important for us to have a Samba machine in the health centre, where the patients are.
C'est important que Samba puisse être dans le centre de santé, en fait, là où le patient est.
Prevention is another aspect of the fight against AIDS. Recent studies have shown that circumcision can help prevent infection.
Research has shown that 60 out of 100 properly circumcised men will be protected against HIV.
MSF is donating kits to support such efforts. Here, volunteers attend an information meeting. Those who want to be circumcised can have the procedure done afterwards.